This House is in session. Minutes of the meeting held on Tuesday, 24th of February 2026, Tuesday, 9th of June 2026, Tuesday, 16th of June 2026, to be confirmed. Honourable Leader of Government Business.
Thank you, Mr. Speaker. I beg to move that the aforesaid minutes be confirmed.
The question is that the aforementioned minutes be confirmed. All those honourable members in favour, please say aye. Those against, please say no. Methinks the ayes have it. The aforementioned minutes are hereby confirmed. Minutes for the meeting held on Tuesday, 7th of July 2026 to be deferred. Honourable Leader of Government Business.
Mr. Speaker, I beg to move that the minutes of the 7th of July 2026 be deferred.
The question is that the aforementioned minutes be deferred. All those honourable members in favour, please say aye. Those against, please say no. Methinks the ayes have it. The aforementioned minutes are hereby deferred.
Announcements by Your Honour, Mr. Speaker.
I am in receipt from a message from the Honourable the Senate to the Honourable the House of Assembly. The Honourable the Senate has the honour to inform the Honourable the House of Assembly that at its sitting on Wednesday, 8th July 2026, the State Acquisition and Vesting of Property No. 2 Bill 2026 was amended in the following terms. In the Schedule Par X, under the heading List of Properties and Persons in the table, the name Marcine Patricia White in the second column and all the words appearing opposite thereto in the first column were deleted. And the Honourable the Senate transmits the amended bill to the Honourable the House of Assembly, inviting the concurrence in the amendment to the bill, dated 8th July 2026, signed President.
Messages from His Excellency the President, petitions, papers, government notices.
Honourable Leader of Government Business.
Mr. Speaker, I beg to give notice of a resolution that the Honourable the House of Assembly concur in the amendment made by the Honourable the Senate to the State Acquisition and Vesting of Property No. 2 Bill 2026.
Honourable Leader of Government Business.
Mr. Speaker, I beg to give notice of the Advanced Passenger Information and Passenger Name Record Bill 2020.
Private members' notices, notices of questions, reports from select committees, first readings of bills.
Honourable Leader of Government Business.
Mr. Speaker, I beg to move the first reading of the Penal System Reform Amendment Bill 2026 and the Advanced Passenger Information and Passenger Name Record Bill 2020.
The question is that the two bills be read the first time. All those honourable members in favour, please say aye. Those against, please say no. Methinks the ayes have it.
Statements by ministers, congratulatory and/or obituary speeches, personal explanations, motions for leave of absence, oral replies to questions, notices of motions for the adjournment of the House on matters of urgent public importance, orders of the day.
Honourable Leader of Government Business.
Mr. Speaker, I beg to move the suspension of Standing Orders 6, 16, 18, 20, 42 subsection 5, 43, and 44 for the remainder of the day's sitting.
The question is that the aforementioned standing orders be suspended for the remainder of the day's sitting. All those honourable members in favour, please say aye. Those against, please say no. Methinks the ayes have it. The aforementioned standing orders are hereby suspended for the remainder of the day's sitting.
Government business, sir.
Government business is the order of the day.
Order number 7, in the name of the Honourable Minister of Health and Wellness, to move the second reading of the Human Tissue Transplant Bill 2026.
On the point of clarity, this is being done in conformity with Section 53A of the Constitution, which allows the minister from either place to present a bill in this chamber. Honourable Minister.
Thank you very much, Mr. Speaker. I'm here today to present the Human Tissue Transplant Bill. I want to begin, first of all, by acknowledging a number of persons who are here today. And we have those persons here because of the significance of the debate that is taking place this morning. Across the public gallery, we have members of the Barbados Kidney Association and the stakeholder representatives who have advocated for decades for this moment to come. They joined us in the other place when this was debated, and they're here again today because of this commitment and because they are eager to see the support of this government, this parliament, for an issue which is not just a legislative matter for them, but it is a lived reality, daily lived reality. Mr. Speaker, when I first came to public life several years ago now, this was one of the conversations that I believe I heard being talked about for a really long time. Human tissue transplant. We had an original version of the legislation, and then that had to be withdrawn prior to February, and some amendments needed to be made. We made those amendments, brought the legislation back from the CPC, worked through it with our stakeholders, excuse me, and now we are here today, having already debated and passed it with broad support, bar none, in the other place. We now come to the House of Assembly to bring this legislation. But we do so on a day that is also significant. As I acknowledge the work of the Barbados Kidney Association and all of the others who did this work, I also want to acknowledge those who are not here today. I want to acknowledge those who did not live to see the day where a piece of legislation that they've waited so long for is coming to Parliament and is having the opportunity to be debated, but to have national conversations around. Those are the patients who are waiting for transplants. Those are the patients for whom dialysis was simply no longer enough. Those are the patients for whom their kidney disease could not be managed any longer, but they needed to have the benefit of a transplant, but did not have a live donor. This legislation did not happen in time to save them. They're not here today to see this, but I also have to honor them. Equally, another group that I need to honor today that are not here is the transplant team. When we debated this in the other place, the transplant team was there with us. They are not here today, but we honor them in their absence, because they're not here because they didn't want to come and see this all the way through. Absolutely they have. This is one of the most significant pieces of legislation for them that could have happened. But they're here today because, as I said when this was being debated in the other place, on the 14th of July, today, they would be undertaking the next live donor transplant of a kidney in the Queen Elizabeth Hospital. As we speak today, a live kidney transplant is taking place in the Queen Elizabeth Hospital, and the transplant team that was with us in the other place could not be here today because they are in surgery, saving a life. They wish they could have been here, but the most important part of their work is the people that they serve, and they are there dealing with that. And so I want, in their absence, to recognize the likes of Dr. Margaret O'Shea and all of the other nephrologists who are right now in surgical theater, knee deep, hands deep, elbows deep, saving someone's life. Today, July 14th. I hope that when this legislation is debated in this place and it is passed, I hope that we then move to a new environment where we don't have to have persons who are depending only on live donor transplants. But we have persons who are equally able to benefit from donations from persons who have passed. When we did this in the other place as well, Mr. Speaker, over lunch, when the stakeholders joined us, I sat with one of the members of the association, and he said something that stayed with me. He says, you know, because I talked about the number of decades that this has been outstanding for. He said, you know, when you have a jar in your kitchen and you're turning it and you can't get it opened, and you hand it to somebody and ask them, could you open this for me? And they turn, but they can't get it open, and they hand it to a second person who they think is a little stronger, and they turn. You may pass through multiple incarnations of trying to get that one can or one jar opened by multiple persons, and then the last person that comes and makes that turn manages to get that jar lid off. They manage to unlock it finally, but it has been loosened by the hands of all those who have gone before and have put their force to the jar's lid to be able to open it. I acknowledge that I get to stand here this morning to turn that jar and to take the lid off. But I come after a long number of persons who came before me, who did everything that they could to open that jar. And so I stand also to acknowledge all of my predecessors, including, and I said this exact thing in the other place when I spoke, so I'm saying it here now again. The persons who came before me, my predecessor, Senator the Most Honourable Jerome Walcott, here in this chamber as well. In this chamber as well, Minister of State Davison Ishmael, who worked along with Senator Walcott when he was in the previous role as Minister of Health. Together, they also worked on this. Before Senator Walcott, we had Minister Ian Gooding-Edgell. He was the Minister of Health. This did not come to this place over decades, because many ministers did not put their hands to the plow. I get the opportunity today to turn it finally and to be able to unlock the contents of legislation to benefit people. And I am very grateful to all those who have turned and loosened this jar, a little or a lot, to be able to get us here today. But what's the actual legislation? Let's get to the legislation. Legislation speaks about human tissue transplant. And it covers a range of things. If I were to go through the legislation, which I will do now, it covers the administration. I'll come through some of those things in a bit. The establishment of a national donor and transplantation registry. I'll come to that in a bit. The donation of tissue by adults. I'll come back to that in a bit. What happens in the case of minors. What happens after death. And it speaks about the prohibition of trading in human tissue. But this piece of legislation, as I will go through it in a few minutes, covers a range of things that also came before. It covers a body of research and a body of work that has sought to modernize the healthcare system. The last time I came to this place, I spoke about the Barbados Medical Products Regulatory Authority. That's an innovation for our healthcare system. We're speaking also about the existence of newly established Barbados Living Laboratory Research. And I want to honor the chair and the leadership of the Barbados Living Laboratory, who reached out to me to say, Minister, I'm so happy that you guys have been able to get this legislation passed through the Senate. I'm looking forward to getting it all the way through. But I want to offer support from the Barbados Living Lab so we can look at the pairing of human tissue, which is captured in this legislation, and that we can create a registry to pair human tissue and to match human tissue. And I said, absolutely not, but I will come a little later to the implementation of what needs to be done after this legislation has been passed. We saw the Pharmaceutical Inc. created, Barbados Pharmaceutical Inc., BPI, so we talk about pharmaceutical services and what's being done there. So when we pull these things all together, BPI, Barbados Living Lab, Barbados Medical Products Regulatory Authority, and all of the ecosystem interventions that have already been undertaken, this is a health sector reform intervention that we're seeing here overall that forms a part of the whole. And in the context of this particular legislation, they're not separate initiatives. They're all meant to be taken together. So what's in the legislation? What's actually in the legislation? I want to come back then to the administration. We talk about the approval of health service institutions and the establishment of a council. This is an administrative matter that speaks specifically about how this legislation is going to be managed. The creation of a transplant council and how they're meant to function, who constitutes the council that is captured in the schedule to the legislation. And then we go on into part 3, clauses 7 through 9 to talk about the establishment of the registry, as well as a public education campaign program and the allocation of tissue. In the other place, one of the things that we talked about, and I said quite clearly, is one thing when you're talking about a living donor, and the transplant that is taking place now is an extensive one. And I asked one of the persons who is from the Barbados Kidney Association, taught me through, in preparation for today, taught me through what actually is going to be happening in surgery as we are in Parliament tomorrow. What happens? And I asked them because they have gone through it themselves. They are themselves here today because they are a recipient of a live donor kidney. They received a kidney from a close family member, and so they gave me their account of what they went through, what it was for a family member to have to go through months of pre-investigations and testings to be able to be readied for that process. What happens in the 3 hours before they actually go into surgery, where that loved one goes into surgery, and they have to think about, if something happens or something goes wrong, this person is my responsibility because they're giving their organ to me. They talk to me about how they don't take out the infected kidney, the dead kidney, but it stays within the abdominal cavity, and they put the live kidney, the new kidney in, and they begin treatment for several weeks, or maybe 3 months, I think the time frame is that they said, on immunosuppressants. They talked about how for the time that they were on immunosuppressants, they could not pick up their 7-month-old nephew because they had to avoid being exposed to anything because their immune system was at the time under strain. So they talked about that. So it's not just a surgical procedure, it's not just a medical process, it's the emotional transaction that takes place between a loved one and the recipient, a donor and the recipient. People, patients, who are dependent on these transplants in order to continue living day-to-day lives, to go back to work, to have families, to have kids, to be able to support their loved ones, and to be able to make sure that they can live their lives to the fullest. That's what this legislation historically is now being built on the backs of live transplants. That's what's happening right now. But this legislation allows people like us in this chamber to say, I want to wear a bracelet, as we've seen in other countries, that says, if something were to happen to me, if I pass, rather than letting the ants take control of my body and my organs, I want to give the gift of life. I want to be able to let someone else's family benefit from my organs if they are in good order. I want to allow that child, that 15-year-old girl, or that 20-year-old man who has been suffering from chronic kidney disease or end-stage renal failure to be able to have the benefit of life after death, my death. And so I said it in the other place, I say it here. I intend to be one of the first people to lead by example and to sign up to say, here I am, choose me. Here I am, use me. Here I am, take my organs and I gift them to someone else because they're no use to me. I trust that my family is going to honor me with a dignified burial. I trust that my family is going to honor me with a send-off that is befitting of my life. I trust that they're going to have the worship team from my church, and they're going to have the band, and they're going to have the dancers, and they're going to sing all of the songs, and that after an hour, no more, maybe an hour and a half maximum, that everybody will celebrate the life that I have lived, but that someone else is able to say, I got Lisa's heart. I got Lisa's liver. Maybe not my liver. I got Lisa's kidney. I want people to be able to say that they stood to benefit from my life and that they also benefited from my death. And in the other place, the Honourable Attorney General who spoke, he also pledged to donate all of his organs. So I see him smiling at me, so I'm reminding that he promised to donate all of his as well. All meaning all of his. But a moment of levity in a serious conversation. But here's what's also true. These are not separate conversations. We're talking about giving people the gifts of life, but we're also talking about what happens when either a living donor exists or someone who has passed. One of the challenges that we've talked about in this country, and certainly in this ministry, has been the prevalence of non-communicable diseases. We've also talked about the fact that we have an aging society. We've talked about the fact that so many people are living longer, and there's even a conversation now about Barbados being the only country behind Japan to have the number of centenarians living in country. So we're living longer. We're not having more babies, but we're living longer, they say. But if we were to be living longer and living longer healthily, then the conversation on living donors or even donors after death would be different. But one of the constraints that a country like Barbados, Mr. Speaker, is navigating is that with the prevalence and the incidence of non-communicable diseases, more and more people are passing on, and their organs, their bodies, are not necessarily ideal donors for other persons to benefit from transplants. So we have to be able to deal with NCDs. We have to be able to make sure that persons who are navigating diabetes, hypertension, heart disease, all of these things, that we're able to identify what these issues are, have them treated early, and to be able to make sure that we're not just living longer, but we're living longer more healthily. So one of my colleagues came into my office, and I've told this story a couple of times as we've evolved it. One of my colleagues came into my office about a month ago, and they said, you know, Minister, I feel as though we need to be able to do something about how people are living with diseases or illnesses that they don't know anything about. So I gave the example in our talking about it, excuse me, I gave the example of me going one day for a random check. I do it every year, usually in January to coincide with my birthday, and I go and I do all of the blood work and all the testings and stuff like that. So they discovered at the time that my HbA1c numbers were higher than they should have been. And I said to them, to the colleagues, I said, well, what are my numbers doing up there? I think I eat well. I don't eat junk all the time, too often, that is. I may not exercise, but my numbers are a little higher than they should be. And the doctor said to me, you know, Lisa, after a while, despite all of that stuff, you can't outrun your genes. It's in your genes. And my aunt had said to me when my daughter was born, she said, you know, diabetes runs in our family. So you have to watch yourself. You have to be careful what you eat. You have to be careful what you consume, and when you have your foods and your teas and so on, here's what you need to do. And I've never forgotten that, and so I have followed her advice all these years later. So when we started talking about in the office, people not knowing what their numbers are, not knowing that you have a history of heart disease. First question a doctor asks you when you go in, do you have a family history of so-and-so? Do you have a family history? Pharmacists ask you some of these questions too, I believe. But doctors for sure ask you, do you have a family history of these things? Thank you. Do you have, what is your family history? Is there anyone in your family with diabetes? Is there anyone in your family with so-and-so? And so you need to know that. You need to ask the questions of your family, and then you need to be able to take appropriate action. And so we came up in the ministry with a proposal. And I said to the team, well, why don't you go away, come up with, we talked about it for a long time, a national screening program. What does a national screening program look like? Know your numbers. You should know if your HbA1c is in the pre-diabetes range or if you are diabetic. You should know these things. You should know if in your family you have a history of hypertension, that your blood pressure is too high. You should be monitoring these things, but sometimes we don't know. And so we agreed, originally the plan was we would start from age 40 and we would go all the way up to 80. And that really came from the fact that we said, well, every birthday, milestone birthdays, sometimes Jubilee, this, oh, I'm turning 40, it's a big number. I'm turning 50, I turned 50 earlier this year. I was excited, but I'm not a big birthday person, so it wasn't a big deal. 60, somebody else is gonna be excited about 70 and 80. And then my staff said to me, but Minister, what about starting at 30? We shouldn't start at 40. Let's start at 30. I said, okay, yeah, we'll start at 30. Then someone else says, Minister, no, but we have to get people socialized into understanding what they need to start doing from early. So what about 20? The other day we were in a meeting with another partner, and the partner said, well, Minister, as an obstetrician, as a pediatrician, I feel as though we should actually start even earlier because we want to. I said, well, we can start now at birth. But the idea really was, whichever age we start at, whether it's 20 or younger, 30 or anywhere thereabouts, but we end at 80, at different ages, we know what we should be screening for. We know what we should be looking for. And so we want Barbadians to now have the ability to combine their celebratory events at milestone birthdays, 40, 30, 20, 80, whatever the age is, with an understanding that you are simultaneously also going to go and know your numbers. What are your numbers? If you are a man and you reach a certain age, when should you be checking your PSA? When should you be checking those things? If you are a young woman, this is what a pediatrician said, should you be looking to see when you should start your pap smears? And should we have the HPV vaccine for girls starting at age 12? That's what they were talking about. What should be the things that we are screening for? When you get a certain age, that's when you begin your colonoscopies to look at your colorectal health. What should be the age that we start screening for these things? Should we be teaching people from age 15, by the time you start to have breasts, what is your status? What kind of breasts do you have? Do you have fibrocystic breasts? These are things that we want people to know about themselves. And that allows individuals to know their numbers, know their status, and to take action as a lifestyle across the board as to what you need to do. So just like my aunt told me at 26 years old when I had my daughter, who's now going to be 26, so that's a long time now. When she told me I have diabetes in my family, it put me on a life course. It put me on a life course as to what I was going to do, how I was going to put food on my plate, what I was going to choose to put on my plate. It's not everything that is in front of me. Sometimes when you go to a buffet, you don't have to have everything that's there. You choose responsibly based on what you know of your own body. And so that's one of the things that came out of this. Why is this important in the context of this debate? We have found that the number of persons suffering from disease, kidney disease included, are highest among those persons who have chronic, uncontrolled, non-communicable diseases. So we want people to know what their numbers are. We want people to know what their medical history is. And we want people to be able to manage their own personal health so that they can make better choices. So we want to make sure that we can do those things in support of our people. But as policymakers, we also have an obligation. We need to be able to figure out where our expenditure is best located. So where should we spend more money? Primary health care, NCD prevention, NCD management. People are presenting to the Queen Elizabeth Hospital sicker and later. That's what we found in the numbers as well. How do we prevent people from getting sicker? And so we want, as policymakers, once people know their numbers, to be able to have the benefit of what we now call a life course framework that tells you if by the time I get to 50 years old, the life I have lived, the choices I have made, because I knew my numbers from the time I was 20 or from the time I was 30, has allowed me to make choices about my own well-being. Those are things that are avoidable. But for the things that are not avoidable, for the things that we cannot avoid, that's where this legislation comes in also. It allows us to make certain that persons, whatever the reason, that they're able to benefit from a healthy organ. That brings me to what happens when you are managing chronic illness. One of the things that we're very proud of, but we know we need more of, is dialysis support. When I first came to the ministry and I was looking to see what our facilities were and what we were offering, I had the opportunity to go to, of course, the Queen Elizabeth Hospital, where we have 24 chairs. We call them chairs, not beds, but chairs supporting dialysis patients. But then outside of the Queen Elizabeth Hospital, there are about 3 additional locations where persons can have the benefit of dialysis support. One of those locations is in St. John Polyclinic, and I talked about that in the other place on purpose. Now, when I went to the St. John Polyclinic, They have a facility, it's a partnership with a private service provider, a Barbadian, SILS, who we met with very recently here in Barbados. And his story is an important one. And with your permission, Mr. Speaker, I'd like to call his name. Kurt Lambert, most honorable Kurt Lambert. He was honored by our country a few independences ago for extraordinary contribution. Many of us would have seen the features in the newspaper, but sometimes we just don't know to make the connections between when somebody is celebrated nationally and they walk across the parade square at Kensington, they collect their insignia, and they walk away. We don't always know what that is for. But if you go to St. John Polyclinic, or if you go to two other locations, one of them in the Maria Holder Trust, the Diabetes Center in Warrens, and then you also have a facility in Carrington Village. If you go to those locations, SILS is the name of the company, led by Kurt Lambert, a Barbadian whose mother suffered with chronic kidney disease. And he decided that he wanted to give back to Barbados because of what he lived with his mother. Out of that, SILS was born. And now he wants to do even more. So across the country, persons are having the benefit of the screening that I talked about in the facility right there in Carrington Village. They are detecting kidney disease before it advances and then leading to treatment. They're working with persons in St. John, in the St. John Polyclinic, where people, they open at 4 o'clock in the morning. Could you imagine getting up at 4 o'clock in the morning and going into a facility to be able to have the benefit of dialysis treatment? Why is that important, Mr. Speaker? Because people want to be able to live normal lives. People want to be able to get up, go have their dialysis treatment, go back home, have their shower, get ready for work, and go on to work as if none of that is actually happening. They want to live normal lives like you and me. And SILS in the St. John Polyclinic and the other locations where they're located allows people to do just that. Hopefully, we expect by end of year, certainly into early 2027, we will see an even further expansion of the capability of dialysis treatment in the country. We've already had the dedicated engagements with the Queen Elizabeth Hospital and SILS, along with the public health officials, to see how we can expand that even further so that people are able to have the benefit of dialysis support in their communities, in situ, without all having to go into the Queen Elizabeth Hospital. We're hoping to be able to have that done in the shortest possible time frame, certainly between now and early 2027. So if I were to come back, I'm giving both context and going through legislation at the same time. So it allows for, at part 4, the donation of tissue by adults, but it separates out the regime for adults from children. And here's what it does. In the case of adults, I could tell you what I want to do, and you are going to have to follow my instructions. Now, I want to take a moment here, pause, to acknowledge the important work done by the Law Reform Commission. Before this bill was being debated in the other place, I had the opportunity it was a Wednesday, I had the opportunity on the Sunday evening to have a call with the head of the Law Reform Commission, Sir David Simmons, and members of his team, just to get a sense of what they wanted to be able to see. They had done significant work, and I acknowledge not just the Kidney Association, the transplant team, but the Law Reform Commission led by Sir David Simmons and his team, Vera Brathwaite and others, who, together with my predecessors, would have worked on the changes and the amendments to this legislation. They undertook, between the Monday and the Wednesday, to go through the final legislation and to share with us in the ministry a summary of the things that they still saw in the legislation that in a future incarnation they would want to have considered once we're past this initial stage. One of those changes was made in the other place, and it was in accordance with the provisions of the Succession Act, where there was a requirement, or under the Succession Act, it usually requires there to be 2 witnesses to sign off on the decisions being made by adults, and so that amendment was made in the other place in accordance with the guidance of the Honourable Attorney General, and so that will be the amendment that we will see having gone through, that we will see today. The other items that they have raised, the ministry will work through them over time, and we will continue to collaborate with the Law Reform Commission. But then we go on to paired tissue. I think I spoke about that up front in terms of the Barbados Living Laboratory and what they're hoping to do. And one of the things that we have already in place, the Ministry of Health has a partnership with the University of the West Indies for an existing registry. The registry is already there, it covers a range of things, and the proposal is, rather than create a brand new registry, even though we see it in the legislation, it doesn't have to be separate and distinct from the infrastructure that already exists. And the proposal is to work together with the University of the West Indies to expand the existing registry so that we're able to have access to the information, and to do so in collaboration with the Barbados Living Laboratory. We met with the University of the West Indies Medical Sciences faculty last week, and in collaboration with them, we also agreed that having a registry and having a ton of data without using the data to make empirical decisions is a pointless exercise. And so we have agreed on a number of key areas in collaboration with UWI to be able to take the data that is there in the registry and to allow it to help us make better empirically led decisions. We also have a section in Part 8 on the prohibition of trading in human tissue. I think that's pretty clear. It's standard. It exists across all the other jurisdictions where this legislation was considered, and we want to make sure that that is in place. Now, I've already spoken extensively about the donation of tissue after death, but I want to be clear here just for clarity. This is not about being predatory. This is not about dishonoring those who have passed. This is about, as I hope it would be for me, celebrating life lived, but also acknowledging my wishes to donate my organs, once healthy, to someone who can benefit from them. In the other place, there was a discussion around what is cultural. There was a discussion around what is normal. There was a discussion around some family members who say, I'm going back to the Lord just as He sent me, just as I came on this earth. But as for me, and at my house, I choose to donate. And that's what Barbadians are being given the opportunity to do, to choose. There was a discussion over many years, I understand, about whether or not we would have an opt-in or an opt-out system. In countries like Switzerland, for example, there is no choice. Once you pass, the government will make a determination and you will have your organs, once they are in good order, donated to someone who needs it. In this case, in Barbados, this legislation very much gives people choice. It allows us to have and to begin a national conversation about that choice, about people transitioning from going back to my maker just how I came into I want to donate my organs to someone who needs them. So that's what Part 8 is about, and I hope that more people will choose to do what I want to do and what the Honourable Attorney General also promises to do. In Part 10, just some miscellaneous provisions, and then you have a number of offenses in the event that people don't do what they're supposed to do. I want finally, as I close, Mr. Speaker, to speak about the importance of us having an implementation strategy. Once this legislation has been reviewed and is passed, it is the intention of the Ministry of Health, one, to establish a National Transplant Council in the first instance, but equally to have an overall strategy that allows us to govern what happens both with living and transplants after death, so that we have a comprehensive framework that supports the transplantation framework that we are developing here, and that's one of the things that is going to happen. And so we will begin to work in the ministry on a national organ donation and transplantation strategy that gives effect to this legislation. We will, and we commit to working together with the stakeholders who are here today. They have advocated for all of these decades to be able to get us to this point, to all who have put their hands to this particular plow, to move with a matter of with immediate urgency to implement the provisions of this legislation, to put all of the communication strategies in place, to put all the consultative strategies in place, and to be able to support the implementation of the strategy as I have outlined. It will begin with a roadmap. What needs to be done first? It will allow us to bring together the clinicians, some of whom I spoke about before, the leadership of the hospital, patients, families, professional bodies, and regional partners. That brings me to the question of a regional donor bank. There has been a discussion around whether or not we have enough organs to be able to donate in a small jurisdiction depending on the health of those organs. And so there has been an equal discussion about whether or not the region should pool their resources together to be able to benefit from organ availability in another jurisdiction in another. And so equally, we as the Ministry of Health want to pledge our support to the regional initiative for there to be a regional organ donor bank where we can pull on the resources of our CARICOM colleagues and our regional colleagues to be able to support people in order to access organs. In conclusion, Mr. President, Mr. Chairman, Mr. Speaker, I think that the discussions that we have had over the last little while on healthcare, how I've started to frame this conversation, BPI, Barbados Medical Products Regulatory Authority, Living Lab, workforce development, all of the things that we're talking about. Transformation to QEH. You've heard Senior Minister Walcott, who has been leading on the capital works projects, whether it is the geriatric hospital, the expansion of the Queen Elizabeth Hospital, or the reform of the renovation of all of our polyclinics. Those are important initiatives, and Barbados is going to give Barbadians the benefit of new infrastructure. But it is my commitment to give the gift of new systems so that we're not putting old wine in new skins. Because if we put the systems that we have had historically over many, many generations into those new facilities, then we would not have done ourselves justice. And so my commitment is to be able to work together on the processes and the systems and the structures that help Barbadians benefit from all of the work that has been and is being done to reform our healthcare system. This piece of landmark legislation, an organ tissue transplant bill which allows Barbadians to have the benefit of tissue transplants. I think there are a couple of changes that we also made, including stem cell transfers. We made those changes at the last minute to make sure the bill was as complete as it could be. We want to make sure that Barbadians have the benefit of our full, complete support for infrastructure that works, systems that benefit people, structures that work efficiently, and to ultimately move Barbados into the third decade of the 21st century, serving people and keeping people first at the center of every single policy decision that we made. This legislation is important. This legislation is transformational. This legislation is life-saving. And with these words, Mr. President, Mr. Speaker, I beg to move that this bill is read a second time.
Honourable Member Sir Michael North.
Thank you very much, Mr. Speaker, sir. And I want to begin this morning, sir, by lending my voice in support to this human tissue transplant bill, and of course, to extend appreciation to and congratulations as well to the honourable member who spoke before me for piloting the bill in this place and giving us a fulsome, comprehensive presentation of the legislation. Mr. Speaker, I'm happy to lend my voice to this bill. It has been a long time in coming, as the Honourable Minister would have mentioned. It has gone through many iterations, it has gone through many paces, it has been stretched, it has been revised, it has been refined. It is not yet perfect, but it is a bill today, Mr. Speaker, that we can be proud of, and we are happy in the Ministry of Health to have the opportunity to lay in this place and the other place before. Mr. Speaker, people ask me if I enjoy being in the Ministry of Health and Wellness, and they usually ask me that with a smirk on their face, and they usually allude to the fact that the ministry is a tough ministry, it's a hard ministry, it's rough. And I oftentimes reply, I work wherever I am planted, and I appreciate the opportunity to serve in any space across our government and in our country. But today is a shining example of why I do appreciate being within the Ministry of Health and Wellness, because this ministry, Mr. Speaker, has the opportunity, like many others, to make decisions and to bring legislation that can impact significantly on the life of our people. Mr. Speaker, this legislation is a shining example of the work of a ministry that can actually save lives, improve lives. And that is why I am, without a doubt, happy to be very much a part of this ministry. Mr. Speaker, the honourable member who spoke before me ended off by speaking about people being at the center of this bill, and she's absolutely correct. The member is absolutely correct, Mr. Speaker. This bill comes as a result of us understanding the difficulties confronting our citizens, persons who are living with conditions such as chronic kidney disease, those who may be connected to individuals who are living with such diseases, renal failure, advanced kidney disease. And it's those persons, Mr. Speaker, who over the years who have advanced the call, who have advocated strongly, who have energized, who have continued to keep, I would say, the fire under the feet of various administrations to make this bill a reality today. People also in the form and person of some of our medical practitioners, Dr. O'Shea, whose name was mentioned, and I didn't seek your permission to mention it, but I mention it in a positive light, Mr. Speaker. Organizations represented here today like the Barbados Kidney Association, these individuals, professionals, and groups advocated strongly for us to be able to come to this place today and to debate this bill. Mr. Speaker, it was the expert knowledge coming from our Law Reform Commission. And the honourable member spoke about Sir David Simmons and, of course, Ms. Vera Brathwaite in particular, two individuals that I had the privilege and pleasure over many, many months since I joined the ministry, and this bill became something on our list of legislation to pursue. I've had several conversations with them as we bounced the bill through its many paces, bounced it back and forth, and tried to ensure that it was covering all of the bases, and that by the time it came before the people of Barbados, that it was a bill that would be able to make a significant and positive impact in our people's lives. And of course, Mr. Speaker, with people being at the center of the bill, I could not start this contribution without acknowledging the expert leadership, the measured leadership of the most honourable senator from the other place, who actually happens to be in this place today as well, the Honourable Jerome Walker. Sir, you see, oftentimes persons see legislation when it comes to the Honourable House, but there's so much work that goes into drafting legislation. In fact, even before the legislation gets to being drafted, there's so much work that goes in to understanding the reason, the justifications, why, and pursuing the benefits and ensuring that when the legislation is drafted, that it is meeting what it's supposed to meet and it is fit for purpose. And I remember sitting in several meetings with the Honourable former Minister of Health and Wellness at the time, with the consultants, with the professionals in this space, and engaging them to make sure that this bill would be all that it is supposed to be. So I want to personally thank them at the outset, all of those individuals that I mentioned, anyone else who has been in any way associated with or connected to ensuring that we have this legislation before this honourable House today. And I'm confident, Mr. Speaker, that once passed and once implemented, that this legislation will play a pivotal role in saving the lives of our people and improving the lives of many others. But why is this bill necessary, Mr. Speaker? Why is it important, and how will it make that difference in the lives of our people? Organ transplants, Mr. Speaker, in particular kidney transplants, are already being done. As you heard the Honourable Minister say, live kidney transplants taking place even today. We have actually, on average, 4 to 5 kidney transplants that take place on a yearly basis, 4 to 5. And that number may seem small to others, but there's a lot that goes in to being able to perform a kidney transplant. But these are live donor transplants. In other words, a person who is alive gives consent once they are a match, once they are a suitable donor, they give personal consent to being able to offer their kidney to save the life of another person, usually a family member, maybe even just a close friend. But one of the key elements of this new bill that we have before us, Mr. Speaker, for me, is found in Part 7 of the bill, which now offers our people an opportunity to have organs donated receive donated organs from persons who have passed away, a deceased person. In fact, Section 23(1) speaks to the various ways, and going down, speaks to the various ways that consent can be given, either by the individual, him or herself, before passing, or if that person is incapable of being able to give that directive, the next of kin is so empowered to make that and give that consent. And Mr. Speaker, this advances, or this introduces for us an element of what is called advance directive. And this allows a person, when they're in a sound state of mind, as the Honourable Minister said, even all now on the floor of Parliament, to be able to say formally, to be able to communicate to family, friends, colleagues, to be able to communicate clearly to all and sundry, I desire to be an organ donor. I desire to give organs within me that are still functional upon my death to be able to save and improve the life of another person. Mr. Speaker, there are many persons, unfortunately, who leave this earth and who take several healthy organs in tow with them as they leave. And this has not really been a reality in our national experience for persons to be willing and able to offer their organs upon their death. But Mr. Speaker, this is something that has been happening all over the world. All over the world, across many different jurisdictions, there's legislation that allows persons to be able to offer parts of themselves in being able to advance, improve, enhance the life of another person. So therefore, with this legislation being passed, and why it is important that we debate it, why it's important that this comes to the people of Barbados, why is it important that this be on the statutes of our nation, is because we believe that with the passage of this legislation, we should be able, Mr. Speaker, to move to about 10 to 12 kidney transplants per year, moving, Mr. Speaker, from the 4 to 5 that I mentioned before. That is a significant increase, potentially. Those are significant lives, Mr. Speaker, that can be saved. 7 more lives saved and improved. Potentially 7 more families, Mr. Speaker, that can be strengthened because that man or that woman has not been able to regain their own strength and their own capabilities. Potentially, Mr. Speaker, 7 more employees that can return to work in full, having received that new kidney. Mr. Speaker, 7 potentially more individuals that can return to their communities to do what? To mentor our young people and keep them on the straight and narrow path. Mr. Speaker, this is strong, effective legislation, and it is going to change our nation. Mr. Speaker, I have a friend and constituent who is here today as well. He's not here necessarily to support me. Let me make that clear. I think he's here, even though he appreciates me and I think loves me, and I love him. He's here because he's also a member of the Barbados Kidney Association. I think he's the PRO, if I'm not mistaken. Yes, and so a senior role in the organization. He's been a part of it for many, many years. And as long as I've known him, he has been an advocate for the Barbados Kidney Association. But of course, he also suffers from kidney failure, of kidney disease. And in all the years that we have known each other, I spoke to him recently, and I know that he goes through his own battles and struggles living with this disease. And I want to make it clear that chronic kidney disease is not one of those ones that you can easily solve with a procedure. You could just do a procedure for some medical conditions, and you take a couple tablets, you drink some syrup, and the doctor tells you get some rest, maybe 2 weeks, and you're back on your feet. Kidney disease is not one of those medical conditions. Our friends, our relatives, our citizens who have kidney failure and have to be placed on dialysis have to change their entire lifestyles to be able just to maintain life. It is a serious and impactful disease. In many cases, they have to spend 2, 3, sometimes even 4 days connected to a dialysis machine just so they can filter and clean their bodies. And in some cases, there are individuals who have to stay on it every single night when they're doing the home therapy. And that is at least 10 hours a night. So therefore, you can imagine the impact on this person's life. The person who has dialysis has to change their entire life to be able to manage this condition. 10 hours a night, Mr. Speaker, when you may want to go out to one of our crop over events that are happening right now, is a significant impact. 10 hours a night, Mr. Speaker, if you go out to the crop over event and then have to get up for work the next day, shows you the impact that dialysis and this treatment can have on the life and the livelihood and the lifestyle of our individuals. Dialysis, Mr. Speaker, is not easy. While it is keeping our citizens alive, it is also wreaking havoc on their livelihoods and their lifestyles. Mr. Speaker, many people don't recognize. They think that when you go on dialysis, that you're just hooked up to a machine, you spend a couple hours and you go back home, everything is hunky-dory. But they don't realize the dipping of the blood pressure. They don't realize, Mr. Speaker, sir, the loss of energy, the loss of appetite. They don't realize, Mr. Speaker, the fatigue, almost chronic fatigue, that our citizens have to bear when they're living with chronic kidney disease and failure and renal failure, Mr. Speaker, sir, and have to be put on dialysis. They do not realize the impact on productivity, sir, when these individuals who were once strong employees, productive individuals in our society, now have to reduce their pace. They have to move slower. They have to do less. Mr. Speaker, and they do not often recognize the impact on the family structure, because in many cases these are breadwinners who then are not able to win bread. Mr. Speaker, they have to change how the family dynamic works. And it puts a strain on relationships. It puts a strain on relationships between husbands and wives, partners. It puts a strain on those who have children, Mr. Speaker, when they cannot be as effective at parenting as they used to be. Mr. Speaker, we have almost 300 people in our nation that are going through what I just described. Almost 300 individuals in our country are right now receiving dialysis treatment. And Mr. Speaker, to give you the scale of the challenge that we're facing, in the year 2006, Mr. Speaker, we had 185 patients that were receiving dialysis treatment. 20 years ago, 185 patients were receiving dialysis. 20 years hence, we now have close to 300 people who are receiving dialysis on a weekly basis. Mr. Speaker, that's 300 people who are connected to many hundreds more. Another reason why this bill is absolutely important, Mr. Speaker, is because the cost to sustain lives via dialysis is significantly greater than the cost to do an organ transplant, a kidney transplant in this case. The upfront cost for doing a kidney transplant is significant. But the long-term cost, in terms of managing them via immunosuppressants, being able for them to check in to their doctors on a regular basis, sometimes however often throughout the course of the year, that cost over the long term is significantly less than if we were managing that same patient via dialysis for the rest of their lives. A single dialysis session, Mr. Speaker, is estimated to be $1,000 to $1,500, $1,000 to $1,200, Mr. Speaker, my apologies, per session. $1,000 to $1,200 per session is what it costs. And given that patients require, Mr. Speaker, multiple sessions in any given week, 3, sometimes 4, you can already see that there is a massive recurring draw on our health budgets. Mr. Speaker, the QH alone had approximately 17,544 dialysis sessions in 2025. I'll say that again for you, Mr. Speaker. 17,544 dialysis sessions were done last year at the Queen Elizabeth Hospital alone, at $1,000 to $1,200 a session. And we outsource a lot of our dialysis treatment to sales, as the Honourable Member and Minister would have said. We outsource a good portion of our dialysis treatment to the private sector. And that cost to outsource dialysis treatment in 2025 was $4,565,561. $4,565,561 for 2025 alone. $4 million one way, outsourced. 17,544 sessions in-house at the QAH. Mr. Speaker, you can see the impact on our budget. But even as I mentioned the QAH and I mentioned the immunosuppressant drugs, I want to pause right here just for a second just to give a public apology, Mr. Speaker, to our citizens who have had a difficult time over the last few weeks in accessing their drugs at the pharmacy at the QAH. Now, I don't hold day-to-day responsibility for the QAH, but I do have the privilege of being able to lead on one of these key projects there, which is the digital transformation of the organization. And since I came into the ministry 2 years ago, I've been leading this project, and the key component of that is the implementation of our health information system. And that system will sit as the foundation and the bedrock that would allow the QAH to be a digital hospital, allowing us to be able to have digital files, electronic records for each citizen, being able to access those files at the tap of a button, and being able to ensure that we don't have lost files, etc., as time goes by. But because over the last 3 weeks or so we started to transition some services within the QAH environment over to our new platform. And as you would expect with any transition from analog and manual processes, there will be teething issues, there will be some technical issues, and of course there were some learning curve issues as well. But I'm happy to say, Mr. Speaker, that whilst it was rough in the first week, in the first few days of the first week especially, Mr. Speaker, over the time that has gone by, we have seen improvement in the delivery of our pharmaceutical services at the QAH, and things are getting better there. So I apologize for the inconvenience, and I want to assure the people of Barbados that we are working assiduously as we continue to roll out the various releases and the various phases of this HIS, this Health Information System. I want to assure the people of Barbados we're going to continue to hold their hands throughout the process, and we're going to make sure that we give them something at the end of all of the discomfort that you feel up front. We're going to give them a system that would allow them to work and function better, Mr. Speaker, to serve them better and to ensure that our healthcare workers are able to be more efficient and effective in the delivery of their service. No more lost files, Mr. Speaker. That's what we're looking for. Enhance safety within the delivery of healthcare. Reduce waiting times, Mr. Speaker. Improve delivery of service. That is what we're working towards with the implementation of our health information system and the overall digital transformation. But, Mr. Speaker, I digress. I was speaking on why this bill today is critical. Mr. Speaker, kidney transplants extend the life expectancy of a patient, especially when compared to dialysis. So once again, dialysis as we're performing now is sustaining life. And we're grateful that we have the technology, we have the systems, and we have the partners that allow us to be able to sustain the lives of our people. But this bill gives us the opportunity to expand the numbers of kidney transplant procedures that can be done for our citizens. And the research tells us, Mr. Speaker, that kidney transplants extend the life expectancy of a patient, especially when compared to dialysis. Beyond extending the life expectancy, sir, I spoke to you about life quality, the quality of life. I've seen and had the opportunity just a few weeks ago to be with the Barbados Kidney Association when they had a presentation, they had a discussion, really, and they allowed a panel, they crafted a panel, and they so graciously invited me to sit on the panel to discuss this same bill before it was coming, and to discuss kidney disease and of course, kidney transplant opportunities in Barbados. And it was during that presentation that I learned quite a bit from those persons who are living with kidney disease and those who are even recipients of kidneys. And Mr. Speaker, sir, I saw, I think a sister, I think one is here today. I saw two sisters, one who was a donor and one who was a recipient of a kidney. And both of these women, full of energy, full of life. Mr. Speaker, you will not be able to tell if they don't tell you that they had kidney disease and went through a whole ordeal of going the transplant process. They went overseas to do it at that point in time, pretty far out as well. If they did not tell you that, you would not be able to tell, because full of energy, having a good time, personalities are on point, and they're just living the best life that they could live. Both of them. The donor, who would have given the kidney, and the recipient who received the kidney. And you can see the impact, the positive impact that opportunity to have a kidney transplant has made to their lives. That was a living example, and there are hundreds more living examples. And with this passage of legislation in here today, and as it goes through its paces, there will be hundreds more, even thousands more of citizens who can also have a new lease of life, Mr. Speaker. It restores our citizens' independence. When you are a dialysis patient, Mr. Speaker, you are pretty much tied to a machine. Your entire life is built around that machine. You cannot be as independent as you need to be. And with this, Mr. Speaker, the reality of mental health issues as well. Because when I talk about NCDs, as I often do, mental health is one of those NCDs that I mention quite often. And there's a connection, an interconnectivity between diabetes, hypertension, and mental health conditions and challenges. Many persons, when they get a diagnosis of cancer, for example, many persons, when they get a diagnosis of hypertension or sugar, as we would say back in the day, when persons get those diagnoses, and many times it puts them into a tailspin, Mr. Speaker. They don't know what the next move will be. They don't know what their future will hold. And that has a negative effect in many cases on the mental health of that individual patient. I have seen, Mr. Speaker, persons who are living well mentally, emotionally, physically, because they are now a recipient of a new organ. So, Mr. Speaker, this legislation today with advanced directive, being able to offer parts of yourself to save the lives of others, pieces of yourself, quite literally, in circumstances where you have passed, this now gives life-saving opportunities to others. We need this legislation on our books. So there's no doubt, Mr. Speaker, that this is good legislation today. But beyond the legislation, what are we doing here? We are reminding our people that chronic kidney disease can be largely prevented, in most cases. Sometimes there are genetics that go into it, and a person may not be able to outrun it. As the Honourable Minister mentioned, being the advice of her aunt, in terms of outrunning your genes. There's some genetic predispositions that persons have. But a lot of these conditions, chronic kidney disease, there is a considerable link to other non-communicable diseases, uncontrolled diabetes, uncontrolled hypertension. These in particular have been shown to be key determinants in persons who then develop chronic disease over time. So there are significant risk factors that can contribute to development of this disease. And I say this all the time. I've said it from this floor of this Honourable House several times. That old adage that I heard when I was a child. An ounce of prevention is better than a pound of cure. And we want to remind our citizens, and I remind them on every opportunity that I get to speak to the nation, I want to remind our people, prevention is better than cure. And we want to stress prevention along a continuum, sir, from primary level prevention to secondary level prevention. Primary prevention for me, Mr. Speaker, focuses on reducing the established risk factors like diabetes, hypertension, and obesity. And we want to encourage our persons to adopt and follow healthy diets, Mr. Speaker. Increase your physical activity. In fact, Mr. Speaker, the research has shown us that if we achieve adequate levels of physical activity, this has a positive impact of 18% in lowering the odds of developing chronic kidney disease. Maintaining an active lifestyle, Mr. Speaker, moving more, has been shown to reduce your risk of developing kidney disease by 18%. That's close to 20%, Mr. Speaker. Close to 20% reduction in the risk of developing chronic kidney disease just by moving more. So I want to encourage our people, become more active. That's primary level prevention. How do we stave off and how we reduce the risk factors? But secondary prevention, Mr. Speaker, emphasizes the early identification of chronic kidney disease, managing our blood pressure, managing our blood sugar. And of course, in doing this, even upon a diagnosis of kidney disease, this can allow for the slowing of the progression of the disease, because there are many stages to it. and you can actually slow its progression by making better life choices. So as a part of our NCD fight generally, Mr. Speaker, I have been pushing and advocating, I've been a strong proponent for the last 2 years of being in the ministry for screening, encouraging our citizens to know their numbers and to maintain their annual or even more regular health examinations. Mr. Speaker, within the ministry we have a mobile clinic. The mobile clinic goes to various sites across the island. We go to public sector sites, we go to private sector sites, we go to events, and that provides an awesome opportunity to our citizens to have access to screening opportunities very close to their home or wherever they may be at that point in time. I'm happy to see, since coming to the ministry over the last 2 years, I'm happy to see the proliferation of health-related activities. Almost every weekend in this country, Mr. Speaker, there's some sort of health fair. Churches are doing health fairs, schools are doing health fairs, non-profit organizations are doing health fairs, providing more opportunities for persons to come and get their blood sugar screened, test, come and get their blood pressure checked and screened. I want to encourage this to continue. And I therefore want to congratulate our partners at SILS because, Mr. Speaker, they have had a screening program in particular for kidney disease, their kidney testing program. They've had it for several years, and they've screened nearly 4,000 citizens in Barbados. Nearly 4,000 of our people have been screened through SILS. That is a fantastic initiative, and I want to, on this floor of this House, congratulate them for so doing, Mr. Speaker, sir. And finally, Mr. Speaker, I want to remind our people that we are what we eat. We are what we eat. We need to pay closer attention to what we put into our bodies on a daily basis, Mr. Speaker, because what we eat today will either help or hurt us tomorrow. I say, and I say it again for emphasis, Mr. Speaker, we as a people need to reduce our sugar consumption, reduce the added sugar, reduce the salt consumption. Mr. Speaker, there is no need for us to use the shaker on the table to add more salt to our meal. I heard certain members say that they have stopped doing it. I'm happy to hear that. And I want to encourage all other members to make sure that you avoid the salt shaker on the table. You do not need any more salt in your food. Eat it as it is. I'm sure it will taste just as good. Reduce the salt consumption, Mr. Speaker. Reduce, Mr. Speaker, and this one may mash a few corns, the alcohol consumption. Many people don't like when I talk about reducing alcohol consumption, but I say it nonetheless, because, Mr. Speaker, the science is now showing us that there is no healthy amount of alcohol to consume. There was a time that they would tell you 1 glass of red wine will do the body good. In fact, the old people would tell you it will kill the worms. I'm not sure what worms it was killing, or if it does kill any worms, I doubt it very much. But I'm saying to you, the science is now showing us, Mr. Speaker, that there is no healthy volume, amount of alcohol for us to consume. So I want to just say, reduce the level of alcohol consumption, in particular at this time, where I know that we are very festive and we're having a wonderful time in our season crop over. I still want to encourage our people, be mindful, consume less alcohol. Quit smoking altogether. Smoking is a bad habit. We need to encourage our people, and thankfully in Barbados we've been able to manage this particular risk factor quite well. But we do still see a lot of persons who are smoking, and unfortunately we have persons who are now vaping and different things like that. I want to encourage our people to quit smoking. I want to encourage our people to move more, Mr. Speaker, move more. And I did not say exercise more, I said move more. That may mean just putting in more steps on a daily basis. That may mean getting your fitness trackers on your watches on your phones to monitor and setting a target of walks and steps, walking and steps per day. That may be as simple as what is needed, but I'm encouraging our people to move more. Drink more water, Mr. Speaker. That's a good strategy. We need to drink more water, Mr. Speaker, sir. And one that we don't speak about a lot, we need to get adequate sleep. I think this is one of my personal Achilles heels, getting adequate sleep. That is a challenge for most of us, I'm sure. But we need to try our best to do it. And Mr. Speaker, if I can say this very clearly and put it in a term that, or in terminology that we will all be familiar with, don't stress so much. The songwriter said, don't worry, be happy. I believe that if we could encourage our citizens to stress less, monitor the level of stress in your lives, it may be difficult, but monitor the level of stress in your life. Don't worry, Mr. Speaker, be happy. And that would allow us to be able to stave off some of these diseases. I want to offer in closing, Mr. Speaker, some suggestions beyond what I've just shared. Because as I speak on this issue over the last 2 years, I've heard that common rebuttal. But eating healthy is very expensive. Eating healthy is very expensive. And whilst there's a lot of work that still needs to be done by this administration to be able to help to ensure that healthy items on our shelves are more affordable, there's more work to be done. Significant work has been done by this administration. I believe in the last budget and the budget before that, we would have expanded the healthy basket of goods, making healthier items in that food basket more affordable, removing or reducing the VAT rating in many cases. So there's more work to be done, but we're going in the right direction. But might I suggest, Mr. Speaker, firstly, we can replace some of the more expensive animal proteins that we consume. We can use legumes, lentils, split peas, and of course we can use tinned fish as well to be our protein source. We can reduce some of the items. And Mr. Speaker, I know that this will sometimes conflict with industry. There are persons out there who would want to obviously advocate for more pork production and more chicken production and more beef production, etc. No problem with that at all. But Mr. Speaker, I'm just saying that if we want to reduce the strain and the hit on our budget, if we want to be able to afford some of the healthier meals, we can replace and supplement. We can take out or reduce some of these expensive proteins, and we can replace them with the healthier alternatives, lentils, split peas, etc. Secondly, I believe that we should reduce and even substitute entirely some of the imported fresh fruits that we buy in our supermarkets. Mr. Speaker, there's a lot of local seasonal fruits that are available. Mango, golden apple, soursop, pawpaw. All of these have significant medicinal benefits to our bodies. They're nutritious, they help us, and they're available to us sometimes right outside in the yard. So it's not that difficult for us to have access to it at little to no cost. Mr. Speaker, there are also seasonal vegetables, tomatoes, string beans, cucumbers. These are all advised because they're affordable and they're very nutritious for us as well. And fourthly, Mr. Speaker, tomatoes. Yes. And fourthly, very good for men as well in terms of prostate health. Mr. Speaker, sir, I would also want to encourage that we replace these 100% imported juices. I say 100% loosely. But these juices that are imported, Mr. Speaker, and we can replace them with homemade local juices, sir. Our Deputy Prime Minister is a strong proponent of this. I've seen her post so many videos, Mr. Speaker, of her juicing. And she is mixing some wonderful concoctions. We can use our local fruits, Mr. Speaker, to make juices and smoothies without having to go and buy these very expensive alternatives. Golden apples, Bajan cherries, all of them provide significant fiber, and of course they reduce our expenses all in all. So, Mr. Speaker, with that, and in closing, I support this bill with all that is within me. It will offer our citizens, Mr. Speaker, the opportunity to literally offer parts of themselves to assist in the improving of lives of other persons, in many cases saving lives as well. It will increase our numbers of kidney transplants that we can do on a yearly basis. Mr. Speaker, ultimately it will improve the lives of our people who are currently living on dialysis, returning fathers to their children, returning wives, Mr. Speaker, to their husbands, returning men and women, Mr. Speaker, to be more active members of their community and this society. This is what we are here to do, Mr. Speaker. That is what Parliament is about. And that is what this Barbados Labour Party administration has been about for many, many, many decades, making a better life for our people. Mr. Speaker, I'm obliged.
Honourable for Christchurch East.
Mr. Speaker, I don't exactly know how one comes behind such a passionate and driven a heartfelt presentation, sir, to break down and talk about the law. But I did take a couple of things from the honourable member's address, and I think Barbados would be well informed to record and replay his advice on health and how you can adjust and deal with your own health from things found even in your yard. I did not appreciate, sir, the fact that at certain points he was looking directly at either myself or Minister Simmons. And because I'm younger, sir, I would probably put it on Minister Simmons. But for all who have ears to hear, let him hear. Sir, I want to thank the Honourable Minister of Health for her presentation here today, sir. And I had the opportunity to hear her present in the Senate, in the other place, sir, and once again here on perhaps one of the most transformative pieces of legislation that has come before this place. Sir, when we often talk about transformative, we talk about transformative in economic terms. We talk about transformative in legal terms. But, sir, this is actually transformative in human terms. I want to acknowledge the presidents of the Barbados Kidney Association. That might be the wrong name, but thank you, the Barbados Kidney Association. And I also want to acknowledge the presence during the presentation, sir, of the former Minister of Health, and Senator, the Most Honourable Dr. Jerome Walcott. I would like permission, sir, to call one other name. And the reason we seek permission to call names is because the House has to be cognizant of the fact that the person is not here to defend themselves. So you usually ask for permission, and you would have to give a statement as to what it is you want to refer them about. I assure you, sir, that the other name I'm going to call is in relation to this field of expertise, and it's in the most positive frame, sir, and that is Dr. Margaret O'Shea. No, sir. I became aware of the need for transplant legislation somewhere about 2015, 2013, when I got into the Senate, sir, in 2013. And Dr. O'Shea, who I've known since I was 11 years old, I actually shared a seat. She sat right next to me in the back of class 4-1, Form 4-1 at Harrison College. And I was a very studious young person, sir. At the time, I'm glad to see that she turned out in the way that she did, sir. But from the time I came into the Senate, Dr. O'Shea was impressing upon me the need for us to have transplant legislation. At that time, it didn't mean anything to me, sir. I straight into law. It didn't mean anything to me. I did not necessarily know anybody who was on dialysis. The first person I knew who was, I guess, relatively close to me that was on dialysis, I don't want to call his name, but he was a magistrate. And that is when we became aware of the severity of it and the life-changing circumstance that surround that treatment. But Dr. O'Shea, literally, sir, at every single opportunity she saw me, what are you all doing about it? What are you all doing about it? The opposition needs to agitate for this. And, sir, when we then became the government in 2018, I got a phone call the day after the election, and it was from Dr. O'Shea congratulating me on my successful campaign, congratulating the government on its successful campaign, and saying you might not have been able to do anything about transplant legislation when you were in opposition, but you are now the government, and I wish to call for transplant legislation. Sir, she has been perhaps one of the most powerful advocates I've ever seen for any cause, for anything in Barbados, and she has fought the fight on behalf of the Kidney Association in Barbados, on behalf of persons who suffer. She is a renal transplant surgeon, and because of her, sir, I actually took up the fight as well. And with the same Senator Walcott, sir, we had a number of discussions on this, and we push to get it to where it is. As Senator Cummins said, as the honorable member said, you know, sometimes people see the person who turns the jar, who actually takes off the lid of the jar, but they don't see all the people who put the elbow grease in to try to loosen it, right? But there have been a number of people who have fought that fight, and I can't call all of them, but I wish to acknowledge everybody who has played a part in getting us to where we are to try to save some lives in Barbados and to do good from this place. Now, having said that, sir, I wish to address some of the concerns that I've heard. Because while we're in here debating, the fact is we cannot ignore the concerns that we hear on the outside. We're a government, sir, not only of in here, but of outside, and of all the persons in Barbados. We have to do a cultural shift and an expansion of our mind to accommodate certain things. Barbados does not have a culture of organ transplants. It does not have a culture of tissue transplants. This is completely new ground. The amount of persons that I have heard say, I want to go back to the Lord with everything that He gave me. Or other such things like, I don't want to donate any organs. How they gonna know that I dead? Suppose they take out something from me and I'm not yet dead. The fact is, sir, if we strip it down, it makes no sense. Every day in Barbados, persons are pronounced dead. Every day in Barbados, a medical examination is done to verify that somebody has passed on. But while that is true in the bald facts of it, we cannot get past the fact that some sectors of our society have this as a serious concern. So whatever it is that we're doing and whatever it is that we're passing, for the full effect of this to happen, we need buy-in from as many people as possible. We need the widest possible donor pool. As the Honourable Minister of Health said, not just located in Barbados, because there's a reason, I'm going to refer to that later down, but we need the widest possible donor pool across the entire Caribbean. We have to look at the cost of treatment as against the cost of possible cures. One might have a steady upfront or a severe upfront cost, but it gives the person a quality of life that the drips and drabs of the treatment don't actually afford the person. So which is why I am glad that in this legislation, there is a legal requirement for education. It says, sir, normally, when we pass legislation, we come behind and we engage the services of the government information service, we engage the services of public affairs, we try to get people on the same page, we ad hoc play catch up to explain what it's about and try to get people to buy in. But because the drafters of this legislation understand that there's a culture shift, it is embedded in the legislation itself at Clause 8, the Council shall establish a program to educate the public on A, human tissue transplantation and its uses and benefits, and B, the importance of registering for donation of tissue. Now, sir, that says it all. And I wish to encourage not just the arms of government, but for everybody who has an interest. When this is passed at the end of this session, sir, then there must be a campaign spearheaded by the Ministry of Health, ably backed up by the Government Information Services and the arms under the Ministry of Information, to inform Barbadians what this is all about. Nature abhors a vacuum. If we don't get into that space and explain that you may have two of something, you may have 2 kidneys. There's somebody who needs one. You can survive on a kidney or 1 kidney. You may save a life. You may also need to know that I can make a decision now while I'm healthy, now while I'm good. that if I was to pass, something from me could go on to help save somebody else. I don't need to take it to rot in a grave with me. But there are many organs that can be taken from me that can help save somebody who is suffering. All now. Actually, sir, the education needs to go on and say that it doesn't have to be me making the decision. If a family member of mine dies, and I am the next of kin, and next of kin is defined in here, sir, in the ordinary next of kin is spouse, then below that is child, and then above that is parent. If I die without having stated my intention, then my next of kin can make that determination. You know what? Let's do something. Let Wilfred do something good while he's gone. Let us donate that. And it is quite often informed by the fact that the family member, that the next of kin knows that there's somebody who is suffering. They know they have a friend, they have a somebody, they know that there's somebody who needs an organ, who needs the tissue. And we keep thinking, when I think human tissue transplant, so I automatically think kidneys. I don't know. For some reason, I automatically go to kidney. It's not just a kidney. Anything. Anything that can be harvested, sir, can be used, even down to eyes. Your eyes can be harvested. Your skin can be harvested to help burn victims. Sir, we need to actually now think about other people. What is best for us as a society? If we could take half of the people who are doing dialysis off of dialysis. No, if we could take half, that they don't have to go down to the hospital 3-4 times a week, that their life doesn't have to be adjusted and interrupted every single week, that they don't have to wait there for it. But because I make a donation at the end of my life, you don't have to do that again. That is over for you. You can live a normal life, an uninterrupted, unscheduled life. Then that's one of the greatest gifts, sir, that can be given. Now, the other issue, sir, I'm going to go through it systematically. That's probably the best way to do it, sir. If we look at the definitions, there are a couple of definitions that I want to touch on. So a guardian in relation to a child, because children come up, we have to talk about protection the most vulnerable. Children come up in this legislation as donors. And a guardian, for the purpose of this legislation, means a person who is acting as guardian ad litem in relation to a minor, or a person who is incapable of acting, making decisions, communicating decisions, etc., by reason of mental disorder or inability to communicate. Now, the guardian ad litem, sir, you know, is a guardian appointed by a court, a guardian under law. It makes a distinction in this legislation between the guardian, sir, and somebody acting in loco parentis. In many instances in our laws, persons who are acting in loco parentis, that is, if, I don't know, if somebody, child used to stay at my house all the time, and it happens in Barbados, children end up living at a house. People end up living somewhere. It used to go by your aunt all the time, and then you just never went home. That person is acting in loco parentis, in the place of a parent. That person does not have the standing under our legislation to give consent for transplantations from a minor. And there's a good reason for that, sir. Sir, next of kin, as I spoke about it, it means in descending order of priority, a spouse, the eldest child who is not a minor, a parent or a guardian, or the eldest brother or sister who is not a minor. Non-regenerative tissue, that's very simple, sir. The definition is almost too simplistic. Non-regenerative tissue means tissue other than regenerative tissue. And regenerative tissue means tissue that after injury, within or after removal from the body of a living person, is replaced in the person's body by natural process. And tissue includes an organ or other part of the human body, a cell, a stem cell, any substance extracted from the human body, including biofluid, but does not include spermatozoa or ova, an embryo or fetus, or blood constituent. So to do blood donation, sir, that does not fall to be governed by this legislation. For those who do the in vitro and the in vitro facilities in Barbados, sir, they're not covered by this legislation. They will act as normal, but tissue is anything else. So those are the key definitions, sir. There's a council which is established, sir, as a National Transplantation Council, and its core functions are to advise the minister on changes and proposed changes to the legislation governing human tissue transplantation in Barbados, provide advice and guidance to medical practitioners involved in human tissue transplantation on issues that arise in the allocation of organs to recipients and the selection of donors. Now, an issue was raised. I heard it on a call-in program. I've also heard it in the other place. I've also heard it on the street, sir, in relation to the fact that there tends to be corruption in the human tissue space, that it leads to the buying and selling of organs, it leads to persons being bumped in priority. If you're a big shot, right, that you will get priority over somebody else who is not a big shot. Sir, our legislation addresses that in clause 9. Allocation of tissue, and this is a serious concern for a number of people. How will this be administered? Who gets the organs? The council should establish medical criteria for the allocation of tissue. That is clause 9. And B, most importantly, a fair, equitable, and transparent system for such allocation to patients awaiting transplantations in accordance with such regulations that the minister may prescribe. No, sir. This is for the persons who are most vulnerable, who have disabilities. No person shall be denied inclusion in the registry as a patient awaiting a transplantation or given priority or disadvantage in the allocation of tissue on any grounds set out in subsection 3. And that grounds are having a disability or a medical condition. So the fact, it cannot be a case of, well, you know, so-and-so can't walk, this person in a wheelchair, so quite frankly, give the kidney to the young athlete. No, not a case of that, sir. So this legislation sought to address up front a lot of the concerns that were swirling in Barbados. The other one, sir, concern that I heard was that these doctors just want to make money. Transplantation surgery involves a lot of money. There are built-in preventative measures and protections in this legislation, sir, that make it illegal for somebody who has a vested interest in the transplantation to play any part either in certifying the person as being dead, in certifying that the person has a condition requiring a transplant, or in advising the person who is making the transplant donation. So if you are one of the persons who is going to be doing the transplant, you are removed by law from any areas of influence to facilitate that transplant. So it can't be a case of I slide a doctor some money because I need a kidney, and this person who is almost dead then suddenly becomes dead so I can get a kidney. Or they advise the honorable member for St. Thomas, honorable member, you got 2 healthy looking kidneys there, they had lots of exercise, right? These are well functioning kidneys. I think you should donate one. So the legislation protects or removes the sphere of influence from anybody who stands to benefit from the procedure. When we're talking, sir, also about benefiting from the procedures, there's a section here, sir, that if I wish to donate, I indicate I wish to donate, I'm entered in the registry who's responsible for the record keeping of all who have consented to donate, all who are on a list for donation, etc. So those records are kept independently in the registry. But if I wish to donate an organ, I indicate and I'm entered in the registry as a potential donor. If somebody is waiting to receive an organ, that person is entered in the registry as a potential recipient. And thereafter, I play no part in who my organ goes to, except in certain very, very limited circumstances. Those limited circumstances, sir, include I can decide that I wish to give my organ to the honourable member for St. Thomas. Sorry, he right in front of me. That I wish to give, and I like him, so if I had an organ to give, he would get one. But I wish to give my organ to him, and I can decide to donate to him, which is fair, which is fine. I can also, sir, if for some reason we are incompatible, so I have an organ I wish to donate, he is somebody, a potential recipient, he wants to get an organ, and I would like to give it to him, but I cannot give it to him. But the honourable member for St. Peter and the honourable member for St. George South also know each other, and one wants to donate to the other one, and they're also incompatible. This is where it gets mathematical, sir. They're also incompatible. We can enter an arrangement, a single arrangement, that allows me to donate to the other person that I'm compatible with, allows the member for St. George South to donate to the member for St. Thomas because they're compatible with him, and we can enter that arrangement, but no money can pass. No money can pass. The monetary consideration, sir, is expressly forbidden by the legislation because you don't want to drift into the buying and selling of organs. What it does is honor the wishes of a donor to donate for the benefit of a particular recipient. Right? It sounds complicated, sir, but you can donate to who you want to specifically. If they can't receive from you, you can make an arrangement to cross-donate with another pair of persons who wish to donate and receive who are compatible. I don't know if that makes sense to you, sir. Right? So that's one that raised there. Now, if we get to, sir, children, the protection of children in here is paramount. Clause 10 deals with the donation of regenerative tissue by adults. So subject to this act, a person who is at least 18 years of age and of full capacity, or who, if he's a minor, is married or is a parent, may, in consideration of medical advice given to him by a medical practitioner in writing signed by him in the presence of a designated transplant officer, consent to removal of regenerative tissue specified in the consent for the purpose specified in subsection 2. This is the only place in here, sir, that a minor can, of his or her own volition, consent to donation. And why? It tends to follow the law that deals with minors, sir, who are married. So while we say a minor has no ability to consent to a contract or to consent to be exploited, the law recognizes, sir, the marriage of minors in certain circumstances. If you are a minor who happens to have been married, then the law recognizes that you have rights as an adult to make decisions, usually within the framework of your marriage. Equally, sir, if you are a minor who has a child, you cannot tell that 17-year-old that their 1-year-old baby or 2-year-old baby needs something from them and that they can't consent to do it. So in these limited structures, in this limited context, where regenerative tissue is concerned, something that's going to grow back, the minor can, of their own volition, consent to the donation of regenerative tissue. And an adult, sir, a full capacity adult, can obviously, sir, consent to the donation. Sir, in all contemplations under here, there is a policy of information. The person who is giving and the person who is receiving have to be fully informed. It has to be explained to them thoroughly by a doctor, by a medical practitioner, of the implications, the possibilities, the contemplations, sir. And you have to consent, for the most part, in writing. There's a form, you have to consent, and the consent, for the most part, sir, there was one adjustment, there was an anomalous situation, sir, where somebody could have consented to the donation posthumously, by one witness. I think that was clarified in the Senate. I believe it's going to be dealt with here as well. So that across the board, where witnesses are required is 2 witnesses. That lines up with the Succession Act of Barbados, sir. But when you consent, your consent has to be written and signed for in the bulk of the circumstances, and it has to be witnessed. However, while the consent has to be documented and witnessed, your withdrawal of consent can happen at any point in time, sir, orally or by indication. So we measuring twice and cutting once for the consent, but if there's any doubt, if I just blink like this, if I'm unable to communicate and you say, wait, you don't want consent anymore, and I blink twice, then they got to withdraw the consent. You err on the side of the withdrawal of the consent. Now, sir, as I said, sir, everywhere here, the doctor, the medical practitioner, the authority has to explain to the donor the implications of removal of the tissue from the body, and the donor has to confirm that he understood the implications. Sir, now where minors are concerned now, so I explained that a minor who is married or who has a child can consent on their own behalf there. But for minors who are not in that category, a parent or guardian may consent in writing to the removal of regenerative tissue specified in the consent given by the parent or guardian from the body of a minor for the purpose of transplantation into the body of a brother, sister, or parent of the minor. So you can only do a transplantation from a minor, sir, where it is to benefit an immediate blood relative. That is a brother, sister, or parent. That is, sir, clause 15.1. And what must be satisfied? The parent or guardian has obtained medical advice from a medical practitioner other than the medical practitioner tasked to transplant the tissue, once again protecting the minor, regarding the nature and effect of removal of the tissue and the nature of transplantation. B, the minor has the mental capacity to understand the nature and effect of removal and the nature of transplantation, and the minor has consented to the removal of the regenerative tissue for the purpose of its transplantation into the body of the person receiving the tissue. So even though the parent or guardian can consent to the transplantation into the body of a brother, sister, or parent, so an immediate blood relative, the minor has to agree. So although they consent on behalf of the minor, it must be explained to the minor. The doctor who is explaining it, who cannot be the transplant surgeon, has to verify that he believes that the minor understood it fully, and the minor themselves have to consent. And as I said, sir, this does not, the person being able to give the consent does not apply to somebody in loco parentis. It has to be parent or guardian ad litem. And the minor at any time before the removal of the regenerative tissue to which the consent applies, withdraw his consent orally or in writing. So they're protected there from the abuser. Where, sir, someone does not have the capacity, so that was a minor who had the capacity to actually understand. Where you have somebody who does not have the capacity to understand, whether a challenge of the mind or some mental deficiency, sir, a parent or guardian of a minor who does not have the capacity may consent in writing to removal of regenerative tissue specified in the consent from the body of the minor for the purpose of transplantation into the body of, once again, it still has to be brother, sister, or parent, where medical advice from a medical practitioner other than the one doing the transplant regarding the nature and effect of removal of tissue and the nature of the transplant is obtained. The minor is not capable of understanding the nature and effect of removal of tissue, and the medical practitioner other than the medical practitioner tasked to transplant the tissue certifies in writing the medical reason for the transplant. This is to ensure there's no conflict of interest. So, sir, and that, as I understand it, it's not stated here, but we got to take it as natural common sense thing. And in doing the research, those consents are only done when it's a life-threatening situation, not when it's optional, not when it's, this would have to be done in a circumstance where the transplantation has to be done now or the person faces imminent death. Right? And once again, it says there, this does not include a person in loco parentis. The transplant officer has to explain to the parent and guardian of the minor the implications of removal of the tissue from the body of the minor, and they need to be certain, fully informed consent, that the parent or guardian clearly understands the implication of removal of regenerative tissue from the body of the minor. So I'm going slowly and almost painfully on this because it's necessary that people understand. What we don't want is to come out of this and be fighting the battle of persons who have a natural bias against it and who have not understood the safeguards embedded in it to protect the most vulnerable persons. I spoke, sir, about paired tissue donation. That's the one where if two persons want to share tissue and they can't because of medical incompatibility, they can find another pair and you can cross-donate. It's called paired tissue donation. And for anybody who's interested in reading it, it's in Part 6, Section 21. But I had explained that before, sir. And it says clearly, the donors and patients in the group must enter into a single agreement to donate and receive tissue according to biological compatibility in the group, and no valuable consideration is knowingly acquired, received, or otherwise transferred with respect to the tissue. And the council has been notified of each such agreement. Now, sir, I do believe no legislation is perfect, and sometimes you have to build the plane, sir, while you're flying it. We did our best to cover the bulk of it, but most of legislation like this is cultural. And as you start to use it, you will then see areas that may require further legislation, legislative amendment, or correction, or even tackling some things, sir, in the regulations. Now, why do I say that? We are very strict in the legislation to say that no monetary consideration, no valuable consideration, etc. But the reality, sir, is that in the tissue transplant where it is expensive. And sometimes, sir, persons wish to compensate others not for the purchase of the organ, but to help cover the cost of the transplantation. So that is something that we may have to, it's not considered here, sir, but it's something that was flagged. And I think we're going to have to look at that as we go down the line. But that is something for another time. So I spoke, sir, about the signing of the witnesses, by the witnesses. Now, one question that was raised, it was raised in the other place, and it was also raised in a forum that I was in relation to, suppose a next of kin decides to donate tissue or an organ from somebody who didn't want to donate, who said in their lifetime that they didn't want to donate. So that is covered by clause 23. 3. A person shall not give consent under this part where this is donation of tissue after death, sir. A person shall not give consent under this part, and by person you mean the next of kin, as we've specified, where the person has reason to believe that the person who died or whose death is imminent would have objected to the giving of consent. So we have to honor the wishes of the deceased. If, sir, I said over and over, I want to go to my grave with all my parts intact, then, sir, my next of kin cannot, if they know that, give consent to take anything from my body. So for those who feel that they wish to go to the grave with everything they came with, then you can do so. Our legislation requires your consent. You can do so in the full knowledge. And Father forbid, so you put it in a document. Then your next of kin cannot subsequently come after the fact and decide that for whatever reason, their child, their best friend, their somebody needs an organ, and let's take it from X person, now deceased or about to be deceased, who their whole life said, don't take nothing from me. Sir, conditions under which a designated transplant officer may exercise authority. The authorization referred to in section 24 shall only be given where, after making such inquiries as are reasonable in the circumstances, the designated transplant officer is satisfied that the consent to removal of tissue from the subject for a purpose referred to in section 24 has been given and has not been withdrawn, and he has no reason to believe that the person whose body has become the subject during his lifetime expressed an objection to removal of tissue from his body after his death for purpose referred to in section 24. So not only the next of kin, but if I am your doctor and I know during your life you said to me, don't take nothing from me, I, your doctor, can advise, and that withdraws, negates any consent that is given. So your rights, sir, are protected even after your death. So when does death occur? We spoke about that one. For the purpose of this part, a person is dead when there's occurred an irreversible cessation of circulation of blood in the body of that person, or irreversible cessation of all functions of the brain stem of that person. If the person is brain dead, and we know how to measure that, sir, and if the person, circulation is only going on through the body because something is pumping it, right? So if you, for all purposes, will never recover, and a doctor will certify you as dead other from the fact that you're being kept alive by a machine, then for the purpose of this, you're dead. Now, why is that important, sir? Because for the transplantations, it is necessary for you to keep the person, the organs, in as healthy a condition as you can up to the point in time when they're harvested. So if the person is brain dead and they're never going to recover, you still use the machinery to keep the blood going through those organs, keep the organs aerated and whatnot, so that when you harvest the organs are not damaged. So somebody looking at the person there will see beep, 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 right? But they're being artificially kept alive for the purpose of honoring their wish to bestow their healthy organs on somebody. Sir, just no medical practitioner who had a family relationship or professional relationship with the proposed recipient shall take part in determining the fact of death. So you will not have the family doctor saying, oh, like, he dead just so that the sister can get the organ. No medical practitioner who has taken part in the determination of death shall participate in the transplantation of tissue to the recipient. And no medical practitioner may be a part of any transplant team where they've determined death. So that's to prevent, sir, I don't want to say corruption all the time, but that's to prevent manipulation of the circumstances to effect what it is that you want to effect. The coroner has to do a non-objection as well, so you cannot take tissue from anybody unless the coroner consents, well, has not objected. The last, coming on to the end, sir, there's a specific prohibition on the trade in human tissue. No person, this is clause 29, no person shall remove or cause tissue to remove from the body of a donor for the purpose of trading that tissue for valuable consideration. For people who don't know what valuable consideration is, that is the legal term for money or a benefit. So if I stand to benefit and I get something that's a tangible benefit to me, that is valuable consideration. We cannot harvest tissue or organs for the purpose of valuable consideration. The other thing I said that we might look back at this, sir, is some of the fines, I think, are a little bit low. And as we start to work it, we're probably going to have to come back as we get going to patch some holes. Sir, anybody who contravenes that section or enters a contract or any arrangement for purchasing parts is liable on a summary conviction to a fine of $50,000 or imprisonment for a term of 2 years or both. This one should not have to be said, but clause 30 says it is illegal to advertise for the buying or selling of human tissue. So I can't go on my Instagram page and put down, I have 2 healthy kidneys, I'm offering one for sale to the highest bidder, or for $50,000 or whatnot. Sir, that is strictly illegal. It is unethical and it is morally reprehensible and it is forbidden by the law. In relation to practitioners, sir, because a lot of this relies on consent, on knowing an absence of consent, on other things, sir, it's a dangerous area unless the practitioner is protected as well. And they have, sir, at clause 31, the good faith exemption. So no personal liability attaches to any medical practitioner or other person for anything done in good faith in the exercise of his authority under this act. So if you're operating in good faith, that is your complete defense under this piece of legislation. Full regulations, full information has to be given, sir. If you do not give full information, so you have to give full information for the person with the registry, but this is the last one I wanted to speak on, and this is a serious one, sir. The identity of donors is confidential. The identity of recipients is confidential. The registry will know that a donation was made from me to the Honourable Member for St. Thomas. But nobody else is supposed to know that. Why, sir? There was a situation in the US where a person received the heart of a murderer. That heart saved their life. It became known that they received the heart from somebody who had committed murder. The person killed their wife and then killed themselves. And that person was subjected to a lot of ridicule. They were subjected to exposure. It became public. It became a topic of conversation to the point where the person had no peace. And there are other instances, sir, here where the knowledge of who you received your organ from has proved problematic to you once it got out in the public domain. This is strictly confidential. The person who donates is doing a good thing to save the life of the person who receives. And we look no further than that. Your organ is your organ, sir, until it becomes my organ, then it's my organ. I hope it saves my life. So the legislation I want to commend the Honourable Member, the Minister of Health. I want to commend all who had a part in it. The law revision also had a part in it. I guess, sir, as it develops, as the industry, as the area develops, we're going to look back at the legislation and fine-tune it to address any things that might arise as it goes into operation. But having said that, you got to start somewhere. And there are persons in here who have waited a long time. There are persons in here who know people who have waited a long time. And hopefully, sir, with the right publicity, with the right frame of mind, with the right approach to it, we can actually create a situation where Barbadians think not just of the here and now. What can I do now? But what also can I do after? Not only what can I do for my family, but what can I do for somebody who needs it? This is a watershed moment in law in Barbados. This is a watershed moment in medicine in Barbados. And I wish to commend all of those who are responsible at any stage for getting us to the point where we are. And so having said that, I fully endorse the passage of this legislation, and I hope that the rest of Barbados joins me. Thank you, sir.
Honourable Christchurch West.
Thank you very much, Mr. Speaker, for the opportunity to join this debate. And also thanks to my colleagues for giving way for me to be able to join at this time before I leave for another engagement. First, Mr. Speaker, sometimes it's interesting to start with a little bit of levity. And sometimes I do that. And when I think of organ donation, please forgive me, but I think of a cousin of mine who received a kidney in Canada. And sometimes I would go to visit him. He actually received the kidney, and I accept that the Honourable Member said that donors and recipients remain secret, but he got the kidney from his wife. And sometimes, you know, when you get a kidney from a family member, everybody knows. So this one particular day, I decided to journey down to see my cousin. And he received the kidney because he had some kidney failure. He was a heavy smoker and a drinker and so on, and that had caused problems with his kidney. He got diabetes and things like that. And when I arrived at the house, I saw my good cousin on the porch with a beer and a cigarette. And I thought, quite interesting, because I know it's just a year or so that he had received a kidney and this had caused it. And then out comes his wife and says, if you keep smoking and drinking, I want back my kidney. And it goes to show it's important to who you get the donation from. Because then after, every time he did something that the wife thought that was detrimental to her kidney, for a day and weeks after that, he used to hear, I want back my kidney. So that, I thought, was quite interesting. He has since passed, but I know his wife is listening, and I know that his wife would have a laugh to hear that I have now spoken of that in Parliament. Mr. Speaker, I do agree with the honourable member that just took his seat. This is a watershed moment in law as well as in medicine. The medical community has been waiting for this legislation for years, and it gives an opportunity to many, many patients, especially those who will get the opportunities for renal transplant. I don't know if you've ever met somebody, Mr. Speaker, who has to go through dialysis, but it's a consistent, constant process going to have dialysis on a regular basis. It has detrimental in terms of the medications you have to be on, in terms of the times you have to spend, what it does in terms of how it gets into the body, how you feel after, before, during, all those kinds of things that really change somebody's quality and quantity of life. And renal transplant, if nothing else, absolutely has changed that quality of life for people. And to have this legislation in place, to put those structures in place, is absolutely essential and a great benefit for the people of Barbados. Mr. Speaker, I took the opportunity to call, and it only permit me to call her name, Dr. Scantleberry, who's a world-renowned transplant specialist of Barbadian descent. And I spoke at length with Dr. Scantleberry about this legislation. And she told me two very important things. She said, the first thing that we must do is we must put in place very good, clear, and precise legislation as to when somebody is brain dead. Brain dead. And this is absolutely important. And what she said basically is perfusion of the brain must have ceased. And we have to make sure that we have good regulations in place to show that perfusion of the brain has ceased in order to declare somebody brain dead. Loss of brain stem reflexes is the second thing that we have to show for somebody being brain dead. And of course, the failure to breathe independently. Once we put those three things in place, and yes, I agree with the legislation that the person declaring somebody that is brain dead must not have any indicate or any play or any movement or any influence whatsoever in the transplant process, be it the harvesting or the implantation. This is absolutely critical to give that separation of who determines somebody is brain dead from who determines somebody can get a particular tissue. So this is critical and important. It's not yet in place, and all the doctors are saying this is the next step that we have to go to be able to put that in place. But then, Mr. Speaker, she then said a very important thing. And it is one thing to put the legislation in place. It is another thing to be able to have people to have that cultural mindset shift, to understand about organ donation and the benefits of organ donation. And I'm going to give two aspects to it. You know, when I lived in Canada, every time you went to renew your driver's license, there would be a box to tick. Are you prepared to give up your organs? And that actually goes on your driver's license. And any time that you then are in a serious accident or a fatal accident, for argument's sake, and the authorities can find your driver's license, the driver's license where you on your own tick the box and says, yes, I can be an organ donor, or I'm prepared to be an organ donor. In fact, it went further. Some years they said, I'm prepared to give which organs? The organs that you can give. I can give my corneas. I can give my kidneys. I can give my long bones. These are things that we need to look at on our driver's license. So from the then, people can say, yes, should I be in a fatal accident or for whatever reason, and my organs become available, I consent to being an organ donor. That on your driver's license. That would be a first step to be able to getting people to be able to understand how important organ donation is. Because when you can give an organ, that will change that person's life, not only in terms of the length of life, but the quality of life that can change and become so much better after you give an organ. The second thing, Mr. Speaker, and perhaps maybe it's interesting for me to be a surgeon as well as somebody who has done a master's in theology, what and how does Christianity align with organ donation? How, and this is something that perplexes many people, how, as a Christian person, can I still give my organs? Well, let me give you some ideas. Most Christian religions see organ donation as the greatest form of charity. Let me say it again. Most Christian denominations see organ donation as the greatest form of charity. And let me go further. Christian denominations see organ donation as continuing the good work of Jesus Christ of healing those that are ill and sick and giving an opportunity for them to get a better and longer life as being like Him, continuing the good work of healing those who are ill. So there should be no divide whatsoever when it comes to Christianity, religion, and organ donation. It is the greatest form of charity. It is an opportunity for you to give somebody less fortunate than yourself a benefit and a gift among others. The third thing that I'd want to say, Mr. Speaker, on this is that organ donation can not only be a benefit to someone, but it can also give people an opportunity to perfect their livelihood. And I'll give you an example. A member was just messaging me and asking me about use of tissue in my profession. And yes, in oral surgery, organ donation, and the use of bone in particular. You know, very often I remember this particular gentleman who came to me many years ago, and he says, you know, Dr. Duguay, I am one of the wealthiest people in Barbados, but I don't have very good teeth. And I want to get this new thing called implants to get better teeth. And I had to say to him, well, I won't call his name, of course. I said, well, sir, you may be rich in money, but you're poor in bone. You cannot get implants because you have no bone. So as time went on, the improvements in modern medicine, we were able to get bone by getting cadaver bone, which was demineralized and sterilized. And I called him up and I says, good news for you. You can now use some of that money and buy some bone. And he was able to get some bone, and then he benefited from a procedure that we were able to do for him. But that could not be possible without, again, opportunities for cadaveric donations so that people who are less fortunate get opportunities. This also gives an opportunity for what we call stem cells, Mr. Speaker. And I don't know how much you follow or the wider Barbados follows modern medicine, but stem cells are what we call plenipotentiary cells, plenipotential cells that have the opportunity to be able to change or morph into cells of other different types. And the best stem cells are what we call fetal or placental stem cells, are some of the types of stem cells. Amniotic fluid, but fetal and placental stem cells in particular. And the benefit of stem cells, and all over the world, Mr. Speaker, there are many people who are getting injected with stem cells, where stem cells are used to repair or replace organ cells that are failing or damaged. And this legislation gives another opportunity for stem cells and stem cell technology to be used across Barbados. This is a very exciting time, Mr. Speaker. This opens up many, many opportunities for Barbados. First, for Barbadians to be able to benefit from modern technology, bringing Barbados into the modern world in terms of medicine. And this is what is so important. It's unfortunate that we are lagging a bit. There are other jurisdictions that have this legislation or legislation like this in place already and have benefited. And what has happened is that it meant that people from Barbados have had to travel to Cayman and to Panama and all these places to get stem cell treatment. Once we can get that in Barbados, then people won't have to travel, people will have better opportunities, and more importantly, people can have a better quantity and quality of life. And this is what's so important. You know, the modern medicine has improved tremendously. You know, every 5 years or so, the life expectancy has increased. Barbados is one of these places that life expectancy is high and getting higher. And it's because of modern medicine. And if we have all these years of research, all these years of trial and error, and we don't learn to take advantage of it so that you can give to our patients a better and a longer life, then what are we doing? And that's what this legislation is about, offering to our patients cutting-edge technology so that they can have a better quantity and quality of life. That's why stem cells are important. That's why the opportunities for renal transplant, corneal transplant, long bone transplant, all these things, long bone harvesting, and then use of cadaver, all these things are important so that people can get a better quality and quantity of life. You know, Mr. Speaker, modern medicine these days is all about extending life. And it's interesting because in this part of the world, Barbados has some of the most per 100,000 centenarians. So obviously we have a head start above everybody else because we already know about longevity. And it's interesting because I think we're second now to Martinique, but we're second in line. Martinique and Guadeloupe, I think, have the greatest number of centenarians per 100,000. But we have, when last I checked, the greatest number of male centenarians per 100,000. So clearly, we in Barbados have been doing something right, and we need to improve on it by using all the modern technologies, giving our people the best chance to live the best life that they can. So I support fully this legislation. I know it will open many, many doors. Will people question it? Yes. Will it be a benefit to Barbadians? Absolutely. Absolutely, it will be a benefit because it will give people a chance, a second lease on life, a second chance to go and do something better. And who knows? Who knows what that person then will be able to add to society? Who knows what that person then will be able to bring to the next person? And you know what's interesting is because there have been some people who received an organ and then on their passing gave a different organ to somebody else. Because, you know, there's this concept about when you receive, pass it on. Pass it on. I'm hearing somebody say, pay it forward. And that's what this is all about. Pay it forward. You who have received so much, pay it forward to somebody else. So I'm very happy to see this. I fully support this. I know the medical community has been waiting for this for a very, very long time. And I can only see benefits that will redound to the people of Barbados. Will it have problems? Yes, it will. Will it be perfect? No, it won't. Will we work it out? Absolutely. Will people benefit? Definitely. This legislation is life-changing. It's not often that we come to this honorable chamber and make a law that can change so many lives. We've done it a few times over the last few weeks. So it says so much about this Barbados of a party government. tackling the difficult decisions, but making choices to redound to the benefit of all of us. Mr. Speaker, I'm obliged.
Honourable Leader of Government Business.
Thank you, Mr. Speaker. I beg to move the suspension of the House until 2:15 p.m.
The question is that this honourable chamber be suspended until 2:15 p.m. All those honourable members in favour, please say aye. Those against, please say no. We think the ayes have it. This honourable chamber stands suspended until 2:15 p.m.